If you are enrolled in a Medicare Advantage plan, subscribe right now. There is a benefit sitting inside your plan right now that most people never fully use. Some people never use at all, and a significant number of people have never even heard of. It is worth up to $500 per year or more, depending on your specific plan. It does not come as a check in the mail. It does not show up as a credit on your monthly statement. And because it does not arrive the way money usually arrives, millions of seniors let it expire every year without claiming a single dollar of it. This video is about changing that. Here is how this story begins. A few years ago, Medicare Advantage plans were competing aggressively for enrollment. They were offering expansive supplemental benefits: dental coverage, vision allowances, hearing aids, transportation to appointments, gym memberships, meal deliveries, after-hospital stays, and something that became known in the industry as a wellness allowance or over-the-counter benefit. This benefit, sometimes called wellness bucks, sometimes called a flex card, sometimes called an OTC allowance, was a quarterly or annual credit that enrolled members could use on a specific category of health-related products and services. Over-the-counter medications, vitamins and supplements, blood pressure monitors, diabetic supplies, personal care items, grocery items with a health designation on some plans. The credit was real. The products were real. And year after year, a remarkable percentage of the people who had access to this benefit simply did not use it. Not because they did not want free money for their prescriptions and health supplies, but because nobody explained to them clearly that it existed, where it was loaded, how to access it, and when it expired. The challenge with the wellness allowance is that it does not behave like money in the ways that most seniors are accustomed to. It is not deposited into a bank account. It is not mailed as a check. According to confirmed reporting from financial publications, these funds are typically loaded onto a dedicated benefit card, sometimes a Visa or MasterCard debit card issued specifically for Medicare Advantage benefits, or they are available through an online ordering system associated with the plan. Some plans load the full annual amount at the beginning of the year. Others load it quarterly. And in almost every case, the funds that are not used by the end of the benefit period, whether that is the quarter or the year, expire. They do not roll over. They do not accumulate. They disappear. And the plan does not call you when they are about to expire. Consider someone like Evelyn, a 73-year-old retired postal worker from Memphis, Tennessee, who had been enrolled in the same Medicare Advantage plan for 4 years. Evelyn knew she had a benefit card somewhere. She had received it when she first enrolled and had used it a handful of times for vitamins and cold medicine. But she had not looked at the card in over a year. When her granddaughter was visiting in March and noticed the card on the kitchen counter, she asked about it. Together, they called the plan's member services line and discovered that Evelyn had $247 sitting on the card from the previous quarter's allowance that was set to expire at the end of the month. They also discovered that a new quarterly allowance of $125 had just been loaded that week for the current quarter. Evelyn spent $460 of combined current and about-to-expire allowances at a participating pharmacy within the next 2 weeks. She purchased her regular over-the-counter pain reliever, her blood pressure monitor batteries, a 3-month supply of her preferred Vindur, of her Vitam, of her and diabetic testing supplies. She paid nothing out of pocket. She had been enrolled in this plan for 4 years. In those 4 years, she had likely let hundreds of dollars of the same benefit expire without using it. The picture in 2026 has added a complicating layer that makes this benefit both more urgent and more precarious to track. According to confirmed reporting from multiple financial publications, Medicare Advantage plans have been quietly scaling back their supplemental benefits heading into 2026. The dental allowance is declining on average, vision coverage is narrowing, and the wellness and over-the-counter allowances, the $500 benefits that attracted so much attention around Somar Dufarnei are being adjusted on a plan-by-plan basis. Some plans have maintained or increased their allowances. Others have reduced them. A small number have eliminated them entirely. The critical point is that the benefit amount you had last year may not be the benefit amount you have this year. And if you are one of the nearly 3 million seniors who were forced off their Medicare Advantage plan entirely in 2026 due to insurer exits, a confirmed development reported by multiple financial publications, your benefit card from your old plan is now worthless, and whatever was on it has expired. Consider someone like Harold, a 69-year-old retired school principal from Atlanta, Georgia, who had been enrolled in a Medicare Advantage plan offered by a regional insurer for 3 years. Harold had used his wellness allowance regularly and had come to rely on it for his monthly supplement purchases and his quarterly blood pressure monitor supply. In November 2025, he received a letter from his insurer informing him that the plan would no longer be offered in his county in 2026. Harold was automatically enrolled in a different plan during the open enrollment period. When January arrived and he tried to use his old benefit card, it was declined. The old plan had ended. The benefits had expired. His new plan had a wellness allowance, but it was loaded on a different card that had been mailed to him in December, that he had not opened, and that was currently sitting unopened in a pile of mail he had set aside during the holidays. Harold spent the first 2 weeks of January unable to access any of his new plan's benefits while the card sat unopened on his counter. Here is what you need to know about where these benefits can be used, because this is the other place where money gets left behind. Medicare Advantage, wellness allowances, and OTC benefits are not universally accepted everywhere. They work at participating retailers, typically national pharmacy chains, certain grocery stores with designated health sections, and in some cases, online ordering portals specific to the plan. A senior who takes their benefit card to a non-participating retailer will find it declined. A senior who is not sure which stores participate may simply not use the card rather than risk an awkward moment at the register. According to confirmed guidance from plan administrators, each Medicare Advantage plan publishes a list of participating retailers for its OTC benefit, either in the member handbook or through the plan's website and member services line. That list varies by plan. What works for one plan does not necessarily work for another. The category of eligible products is also more specific than most people realize, and getting it wrong can result in a declined transaction even at a participating retailer. Wellness allowances and OTC benefits are designed for health-related products. Over-the-counter medications are almost universally covered. Pain relievers, cold and allergy medications, antacids, sleep aids, vitamins and supplements are typically covered. Blood pressure monitors, glucose meters, and diabetic supplies are typically covered. Personal care items with a health designation, certain bandages, wound care supplies, first aid products are typically covered. General food items, household goods, and non-health personal care products are typically not covered, even at participating retailers. The card may work at the pharmacy but decline at the general merchandise register. Understanding the eligible category before going to the store prevents the frustration of a declined purchase on items you assumed would be covered. There is also a separate and equally overlooked benefit that deserves attention in the same conversation: the Extra Help Program for Medicare Part D prescription costs. According to confirmed reporting from Saving Advice, many seniors are shocked to learn that assistance with prescription costs through the Extra Help Program may still be available even if they already receive Social Security retirement benefits. Extra Help is a federal program that reduces or eliminates the premium, deductible, and copays for Medicare Part D drug coverage for beneficiaries with limited income and resources. In 2026, the income and resource limits for Extra Help eligibility are higher than many people assume. And some seniors who believe they earn too much to qualify actually fall within the eligible range, particularly after accounting for deductions for medical expenses that some states allow. According to confirmed program data, approximately 2 million people who are eligible for extra help are not enrolled because they have not applied, assuming they would not qualify. The most important action any Medicare Advantage enrollee can take right now is to locate their benefit card or call their plan's member services line to find out whether they have a wellness or OTC allowance and how much is currently available. Ask specifically when the current allowance was loaded, when it expires, and what the eligible product categories and participating retailers are. If you have a benefit card that has not been used recently, check the balance. If balance is available and expiration is approaching, use it before it disappears. And if you have recently been switched to a new Medicare Advantage plan, either because your old plan exited the market or because you made a change during open enrollment, confirm that your new plan's benefits have been activated and that any benefit cards associated with the new plan have been received and are ready to use. One scam warning. There are callers specifically targeting seniors with offers to help them claim a new $500 Medicare benefit, claiming that a new government program requires registration to access the benefit or that a limited enrollment period is closing. The Medicare Wellness Allowance is not a new government program. It is a plan-level benefit that is accessed through your existing Medicare Advantage plan. No registration is required. No third party needs to be involved if you receive a call claiming that you need to register for a new $500 Medicare benefit and that you must provide your Medicare number or bank account information to access it. That is a scam. Here is the confirmed summary. Medicare Advantage wellness allowances and over-the-counter benefits are real, plan-level benefits that provide eligible members with credits of up to $500 or more annually for health-related products and supplies. These funds are loaded onto benefit cards or accessible through plan ordering portals, not deposited as cash. Unused funds expire at the end of each benefit period and do not roll over. In 2026, many plans have reduced or restructured their supplemental benefits, making it more important than ever to verify what your specific plan currently offers. Nearly 3 million seniors were forced off their Medicare Advantage plans due to insurer exits in 2026, and former members of discontinued plans have lost access to any remaining benefits on those plans. Extra help for Medicare. Part D prescription costs is available to eligible seniors regardless of whether they receive Social Security and is underutilized by approximately 2 million eligible beneficiaries. Leave a comment below with your state and your plan experience. Every comment is read. Subscribe so you do not miss the next confirmed update, because Medicare benefits are changing faster in 2026 than in any recent year, and staying informed